Good afternoon, everybody, and welcome to our UNIV 391 COVID-19 and the Mason Impact course. We are excited to be able to have you today. I think that this is going to be a really exciting session today, and one that really hits a lot of us close to home because we have Dr. Emily Ihara going to be talking about her work in social work, especially about working with the elderly and when do we get to hug our grandparents. I have a few announcements about class that I wanted to begin with. The first one is that I wanted to recognize that Eid is Friday, and so we want to not have a deadline for this week on Friday. So all of this week's responses for the three speakers will be due by midnight on Saturday, not midnight on Friday. And Krista is updating that in Blackboard as we speak to make sure that date is there. I wanted you to recognize, though, that that means that because we need time to be able to grade everybody, we're then going to, your grades for this week won't be turned on until probably Tuesday morning. And so it's important that you're paying attention to where you are right now and make sure that if you're worried that you're not going to have enough of satisfactory grades, that you have 3 opportunities this week and 2 opportunities next week. You need to make sure that you're doing high quality work on all of your responses. And as a reminder, you need 9 total satisfactory responses to be able to pass the class. Most of y'all are fabulous. You're saying interesting things, you've kept up with the work, and so I don't have a concern. If you do feel like you have a concern, especially if you feel like even with the 5 opportunities this week and next week to be able to do responses, if you feel like you're still not going to have 9 or you're not secure in that, we would encourage you to be able to have a conversation with your advisor. The selective withdrawal date passed last week. We sent that message out about that. So your ability to withdraw yourself from the class is not available anymore. And so your options would be you will either get a non-satisfactory grade for the class or that you have a conversation with your advisor. The other thing is if you are struggling with issues, I wanted to remind you that even as incoming students, our CAPS program, our counseling program is available to you. So want to make sure that if you need that, that's there. And I want to say that for just a few students, the vast majority of you are doing fabulously. We're appreciating your thoughtful comments, how many of y'all are engaged in the conversations. I am loving seeing the questions that are coming up, and we have way too many to be able to get to in any time during our speakers. So I am particularly happy with how well you're doing and hoping you're enjoying getting this opportunity to meet our faculty and to get if you're new to Mason, to get a taste of sort of the tools and the expectations we've got so that you're set up for success as we begin the school year. The other thing I wanted to remind you is next week already is the last week of class, and there are only 2 presentations, Monday and Tuesday. The deadline for next week's presentations for your responses will be Wednesday at midnight, and we will be doing final grading, and your grades will be posted sometime the following week. So just a reminder that those 2 presentations, I think they're both fabulous presentations, and so I encourage you, even if you've got many of your satisfactory grades, there's even a reminder that if you've got more than 10, you get a badge for being excellent. And so those last 2 on the modeling that we're doing and then the safe return to campus, I think, especially given the questions you had yesterday, will be particularly interesting. So I think those are all the announcements that I have. I wanted to remind everybody that there are, again, the 2 boxes at the bottom. The chat box at the bottom is for your conversation with the TAs about the mechanics of the class. But a reminder that we really want that to sort of go quiet while you're listening to the speaker for the day. On the other hand, the Q&A box that you've got is your place to be able to post questions for Dr. Ihara, and we are and I curate those, but it's your opportunity not only to post questions, but to vote questions up so that the ones that are most interesting to everybody are the ones that are more likely to be asked. And so don't feel like you need to wait to the end to be able to post those. It's actually harder for me to be able to curate them if you do that. So make sure that you're asking the questions as we go and as they occur to you. And based on, there were fabulous readings and a couple of really nice videos to watch for today. So you can also ask questions about those. So with that, I am really excited to introduce you to my friend and colleague, Dr. Emily Ihara. Emily and I have worked together since I first came to Mason. Emily is now associate professor. I'm associate provost. She's associate professor and chair of the Department of Social Work. And she is here today to talk about when can I hug my grandmother. So Dr. Ihara, I'm going to turn it over to you.
Thank you, Bethany. And I'm going to share my screen. All right, so I changed the title just a bit, but it really still is about when can we hug our grandparents. Thank you again, Dr. Usher, for creating this really interesting and engaging class about a very timely topic. And I'd like to begin by acknowledging that here in Northern Virginia, George Mason University sits on the land of the Manahoac people. And since we are connected together digitally through the internet, I invite you all to join me in acknowledging our shared responsibility to consider and act upon the legacy of colonization that is embedded within the technologies, structures, and ways of thinking that are part of our daily lives. This month in particular is one where I am reminded of many people who have come before me, in Japanese and Japanese American culture all across the globe, actually. We celebrate something called Obon, which is really a gathering of joy and a time to honor our ancestors. And so I want to honor them, to think about those who I have loved, those who have influenced me, and those who I don't even know, who have all come before me and laid the path for me to be here today. I'm mindful of the ways in which all of our lives are interdependent. And by the end of this talk, I hope I will convince you all to act upon this notion of interdependence and interconnectedness. So just a brief agenda. So I'm actually going to talk a little bit about the social determinants of health, which is one of my main research areas, and how social connectedness or disconnectedness is a social determinant of health. Some of the risk and protective factors of social isolation and social connectedness, and then how you might help influence social connectedness for older adults in your circles. So a little bit, this is sort of an introduction to me. So this is a map of Los Angeles County, and this is where I was born and raised and spent a bulk of my adult my life, I guess. And so on this map, you'll see various colors, and it gives you a little bit of insight into why I'm interested in issues of health equity and social determinants for older adults and marginalized populations. So as I was growing up, we lived in this very diverse working class neighborhood. Our neighbors were African American, Asian American, Latinx, and white. And I don't know if I have a pointer, but maybe, can you see that if I do that? Yes. So in this area is basically what would be considered South Central LA. And that's where I grew up. And that area has a life expectancy of 79.3. I'm going to zoom in a little bit so you could see it better. So more specifically, we lived right around here. So we were on the border, and right up here is what was considered the Wilshire area. And that has a life expectancy of 83.7. And for some reference, I imagine you all know where Beverly Hills is, but a little bit west of that is Westwood, where UCLA resides. And the Westwood area has a life expectancy of 87.7. So I only introduced this as a way of thinking about how neighborhood, how place, how the social environments in which we live really affect people's health outcomes over the course of a life. And my first teacher, almost from birth really, was a woman from Missouri. Her name was Mrs. Susie Todd, and she was in her 70s at that time. So she had a preschool across the street, and you might consider it an early version of Head Start. And so as a baby, because my mother had to go to work, I went there every day since um, she had no daycare available. And I apparently through osmosis absorbed all the things that were happening in that tiny little classroom, and I learned to read at an early age. But she was my first stereotype myth buster, right? Because she continued to teach kids much in the same way as a preschool teacher well into her 90s. And I straddled two very different worlds. So, this neighborhood that I lived in and the private school I attended on scholarship, where the wealth differential was high and the life expectancy was long. So, every day on that 15-minute public bus ride from my neighborhood to that exclusive school, I witnessed the many changes in racial ethnic makeup of the people, the types of cars that were parked in front of residences, and even those types of residences that existed. Some were in my neighborhood, were more apartment buildings. Um, and as we got closer to my school, they became really huge mansions. And the types of stores that existed, right? And so, or even the way the appearance of the streets were. And I didn't know it then, but these were really pivotal experiences that shaped my understanding of the world. From there, I went to Berkeley as an undergraduate, and I graduated with a degree in sociology and a minor in Asian American studies. And I really had no direction when I graduated, but I got my first job at a multi-purpose social service agency that was dedicated to Japanese Americans in San Francisco. And it was called Kimochi, and it was actually formed by activists in the 70s, 60s, and 70s who wanted a place for their grandparents to be taken care of, right? A place that was culturally relevant, that had the kind of food that they liked and the kind of activities that they wanted to do. And it was really my first introduction into working with older adults. I fell in love from the minute I did that, but I soon realized that living off of $17,000 a year was really difficult. So I went back to school and I got an MSW at UCLA. And from there, I worked in different areas as a social work practitioner. I worked in child welfare and mental health and hospitals and in inpatient and outpatient psychiatric hospitals as well. And ultimately, I went to pursue a PhD in social policy at the Heller School for Social Policy at Brandeis University. And that's what brought me here to the East Coast. And it was really there at the Heller School that all of my experiences growing up, everything I'd experienced as a young adult in college, the community activism that I participated in, my volunteer work with ethnic communities, and my social work education came together to form this interest in the social determinants of health and the elimination of health equities. So a little closer to this home is this map of Washington, D.C. And so if you're familiar with the D.C. area, you'll see that these are the metro lines. And it's the same idea where you look at life expectancy in different neighborhoods. And so along the red line, there is, it runs from DC all the way out to Montgomery County in Maryland. And it has a 9-year life expectancy gap, right? Much better out there in Maryland. And the orange line, which is close to us, comes out to Vienna, and there is an 8-year gap. For the green line, which goes out to the green belt, also in Maryland, there's a 3-year gap, and the blue line has an 11-year gap, and that comes out to Arlington. So it's just an interesting way to examine how place affects how long people live, really. And so this chart looks more at a state level. And so across the United States, there are gaps in life expectancy between the lowest and the highest levels. And in our state in Virginia, we have a fairly large gap with a high of 80.9 years and a low of 69.5. But if you know anything about Virginia, it sort of makes some sense, right? Northern Virginia, in some ways, is very different from the rest of the state. And even within Northern Virginia, there are pockets of places where zip code really makes a difference in health. And in terms of this slide is useful in the sense that a lot of people think that health inequities, if they are if you note that there's racial and ethnic health inequities, that some people say it's because let's say the stereotype that all Black people are poor, and that is a stereotype, right? So this slide breaks it down by income and the association with health by ethnic group. And so a lot of the research has shown that poverty, low socioeconomic position, income and wealth inequality, racism and sexism have detrimental effects on health status. And so as we think about who is dying during this coronavirus pandemic, right, we really have to pay attention to the people who are already at risk. And this relates both to race, but also to age. And in the US, this social gradient of health has been documented repeatedly for a wide range of health outcomes, not just life expectancy, but various diseases or illnesses. And these gradients really reflect power differentials. At all levels of socioeconomic position, health and illness fall along a social gradient. So there are those at lower levels experience worse health than everyone above them. So it doesn't matter where you are on this gradient. There's always people who are doing better than you. And the takeaway message really is that both income and racial ethnic group matter. As a society, we've been heavily influenced to believe that efforts to improve health should come from the healthcare system as the key driver of health and health outcomes. For decades now, researchers have been identifying the non-medical factors that influence health outcomes. And only recently has this become part of the national agenda in the US. Unfortunately, there has been increased recognition that improving health and achieving health equity will require broader approaches that address the social, economic, and environmental factors that influence health. As a social worker, I appreciate the most holistic definition of health that comes from the World Health Organization as a state of complete physical, mental, and social well-being. And using this definition, we see that health is not separate from access to adequate employment, housing, food access, and social support systems. The social environments in which we are born, live, work, play, and grow older are critical determinants of health and well-being. And in addition to access to healthcare, the social determinants of health include factors such as socioeconomic status, education, neighborhood and physical environment, employment, and social and community context. So this community and social context is also broken down into more specific issues, which is what we're going to talk about today. And those are things like social integration, support systems, community engagement, discrimination, and stress. So although there are many models that really illustrate the social determinants of health, this rainbow model, the Dahlgren-Whitehead rainbow model, is one of the most widely used model. It was developed by Dahlgren and Whitehead in 1991 and really maps the relationship between the individual, their environment, and health. So if we look at individuals placed at the center of the diagram, surrounding them are various layers of influence on health, such as individual lifestyle factors, community and social networks, living and working conditions, and then more general social conditions. So more specifically, social determinants that negatively affect health include unhealthy living and working conditions, barriers to accessing economic and health resources needed to establish and maintain health, and loss of economic security resulting from the direct cost of illness or the loss of ability to participate in the economic system. So if we look just at this yellow circle, this part of the diagram, the social and community networks, is really about the ability to be a part of a community to help you get through life, right? If you think about all of the people who help you get through your life and what you would do without them, I think that we would all be able to name quite a few. Some people, as I had started with, are people you might not even know, but we have to appreciate, you know, the grocery store workers, the truck drivers, the meat packers, whoever it is that are helping all of us live our lives as we are, even though we are currently somewhat isolated, I would say, right? And one of the readings or one of the videos they talked about that we're human beings are social by nature, right? And so those high quality relationships are really vital for health and well-being. Like many other social determinants of health, however, social isolation can be associated with poor physical and mental health outcomes, including higher rates of mortality, depression, and cognitive decline. In 2017, the Surgeon General at the time, Vivek Murthy, called it a loneliness epidemic. And this quote, right, during my years caring for patients, the most common pathology I saw was not heart disease or diabetes, it was loneliness. He is a true warrior in this fight against loneliness, and his quote is quite poignant. But as we think about all of the people who and the social relationships that are so important to help us all thrive, we know, right? We know from experience, but we also know from research. There are lots of examples about babies who do not have human contact and they fail to thrive and often die. And if you think about solitary confinement, it is also a way of isolating people as an extreme form of punishment and even torture in some places. So I think that as we think about social relationships, it's quite important to note how important they are. In the social work profession, eradicating social isolation is one of the 13 grand challenges for social work. This was in 2015, they had 12 grand challenges. This year they added a third of eradicating racism. And it's really important because it affects all of us across the lifespan. But we're going to go into why it affects older adults a little bit more. So I want to start with the definition, which I hope you all understood in the readings, in terms of the difference between social isolation and loneliness, right? So social isolation typically refers to the inadequate quality and quantity of social relations with other people at the different levels where human interaction takes place. So that could be at the individual level, the group level, community, and the larger social environment. Examples of this are living alone, having few social network ties, having infrequent social contact, or poor quality relationships. On the other hand, loneliness is a feeling. It is an emotional perception that can be experienced by individuals regardless of the breadth of their social networks. And more importantly, it is the discrepancy between their desired level of connection and the actual level of connection. So we have sort of objective measures of social isolation that we use, and then there's loneliness, which when you're asking people how they're feeling about it. And so you can be both. You can be socially isolated and lonely. You can be lonely but not socially isolated. You can be socially isolated but not lonely, right? So they're not interchangeable, although a lot of times we talk about them together. And some other terms that you might hear that refer to similar concepts include social connection or social connectedness, social networks, social support, social relationship, and they all refer to related situations. But the most important takeaway really is that a person can be isolated and not feel lonely, and can feel lonely even if he or she is not isolated. So in terms of what we know, so prior to the pandemic, this is some data that had already been collected. And we know from the US Census that one-person households are on the rise, right? So that more than a quarter of the population are living alone. And we've already said that social isolation, one of the objective measures is that you're living alone. Oops, sorry. And loneliness increases, oh, sorry, my Zoom. Loneliness increases earlier death by 26%. Social isolation increases earlier death by 29%, and living alone increases earlier death by 32%. And that was done, it was a huge study that Dr. Holt Lundstad did back in 2015, but looking at a range of studies, really looking at how these concepts overlapped. And I'm sure you've read also or heard that loneliness is more dangerous than obesity and as damaging to your health as smoking 15 cigarettes a day. In an AARP study that was done in 2018, they found that approximately 1 in 3 adults age 45 and older reported feeling lonely. And so we have, as you may know, we have a growing population of older adults. And so we can just expect that number to continue to grow. Particularly of concern are older adults who are low income. So, for example, nearly half of midlife and older adults with annual incomes of less than $25,000 report being lonely. And at least 10 million people over the age of 50 live in poverty in the United States. People who are lonely and socially isolated are more likely to have health problems, and those can have serious financial implications. Social isolation is also associated with an estimated $6.7 billion in additional Medicare spending annually. So the various things that factor into loneliness include things like the size and diversity of an individual's social network, being physically isolated as some of us are. And then other contributing factors might include age, depression, urbanicity, anxiety, and overall health. In the AARP study, they also found this year that LGBTQ status plays a role in loneliness. So midlife and older adults who identify as LGBTQ are more likely to be lonely, so 49% compared to those who do not, 35%. Also, the people who have not married or are divorced or separated tend to be lonelier than those married. Although we also know about the research where married men are the happiest and married women are not. So that's a different story. But we should also consider the caregivers. So for unpaid caregivers, the loneliness gap is 8 percentage points higher than for non-caregivers. I'm not sure why that's, okay, sorry. Going back to this slide. So in terms of the trends over time, AARP did this study in 2010, and then they compared it to 2018. So the population of lonely people over the age of 45 had grown by 5 million people, from 42.6 million to 47.8 million in the past 8 years. And of those who counted as being lonely, 41% said feelings of loneliness and isolation have persisted for 6 years or more, while 31% indicate they have felt lonely for 1 to 5 years, and 26 for up to a year. And as we, and our lives all changed in March, right? So this map is of the nursing home population. In 21 states, at least half of the deaths are linked to nursing homes. And it's certainly a concerning issue. But part of the problem is that the nursing home population is just a high-risk population, given a few things that I'll talk about in a minute. So when we think about efforts to address loneliness, we really have to begin with an awareness that loneliness is not only closely connected to the well-being of older adults, but can also impact health adversely. So all of us have a responsibility and can help identify people who are experiencing loneliness or maybe at risk. And some of those ways that we might help folks would be to encourage and support meaningful social connections and more frequent interactions, perhaps through volunteerism, participation in groups or home visiting programs, and various things might mitigate loneliness and the associated health challenges. So again, for nursing home populations, this has truly been quite a crisis. And the issue, however, is that it's not just age that makes them at risk, right? So age is associated with chronic health conditions and compromised immune systems. But it's also because some folks are living in congregate settings, such as nursing facilities or even independent living communities. So when they're living in close proximity, the virus can spread more easily. And they may be reliant on others for things, activities of daily living, perhaps some personal care or shopping or cooking of meals or those kinds of things. So the physical distancing that is the good practice that we should all be following is not always possible for some folks who have needs that they need help with. And one of the things that's been happening throughout this process is that there's been a lot of sort of ageist rhetoric that has come about, right? So the newspapers are rampant with it. The way that the reporting has happened has been very difficult to watch, really. And this was just one headline, but there are so many more. And then there was the whole movement for boomer remover. I can't even remember it. It was so horrible. I didn't want to put it on here. But so I think that one of my professional organizations is the Gerontological Society of America, and they are really trying to put out a different message in terms of how we talk about people, about older folks, right? So there's just some examples. Instead of using the word vulnerable because it otherizes them and reifies stereotypes as older people who are weak or frail. And then we don't want to use saviors or victims because it stigmatizes people. It demands that some groups have to make some kind of sacrifice. I think some of the messaging has been, save your grandparents by like not going out, right? So we want to move away from that. And then the whole idea of who is worthy. It was a very disturbing idea that, the doctors have to choose in Europe. I forget if it was Italy. They were talking about, is this person's life worth saving, right? And because it invites that evaluation of deservingness. And so what we would hope to instead replace that with is this idea of interconnection as strength. That we have a responsibility to all, and that everyone's stepping up to do the right thing. So we're not saving or sacrificing each other. We're all trying to do the right thing, right? I have all kinds of problems with my strange. Okay, so we're going to move on to some of the solutions. Before all this happened, actually, before I get into this, I do want to make a plug. So we're doing a summer team impact project about social isolation and loneliness and comparing the situation here in the US with the situation in Japan. And so our students will be giving a presentation or two at least on August 14th. I'm not sure how that will, I'm sure it'll be virtual and it'll be fabulous. So, but yes, so, but that team is being led by Dr. Megumi Inoue, and we're working in anthropology with Dr. Courtney Hughes-Rinker, and in public policy with Dr. Naoru Koizumi. So that's another place where our research is really kind of coming together in terms of how COVID has really affected the services that are being delivered to older adults in both countries. But moving on to what we're doing, so we have a gerontological research team here at Mason in the social work department, and we've already been doing various initiatives where we look at creativity and look for ways to bring creativity to older adults. But one of the things that has been really inspiring, if you've seen it over the last 4 or 5 months, right? It feels like forever. But as you see those heart-wrenching stories about people, folks in nursing homes who are not allowed visitors, right? Where they're doing window art, or they're doing drive-by parades, or shows outside so that people can come to the windows and watch. There's also lots of people trying to connect via technology through Zoom or FaceTiming. And so those are all great. But if we think back to what I had mentioned earlier about some folks who are really sort of at risk are people on the lower income, or perhaps they don't have enough resources, and perhaps they don't even have family, right? So they are truly socially isolated. And those are some of the people who might not have both the people support and the financial support to connect with others. I think that we have to be creative in these kinds of situations. And as we think about, I think they've said it in many different ways, but this crisis really will spur so much change, because the way we approach problems will have to change, right? We really cannot continue to have, this level of this map. We can't continue to have this map. This map actually was from July 23rd. And as of that date, let me find that number, it was a lot of people. I can't find the number right now. But the red ones are where I think that's where there's high percentages of deaths in nursing homes. But for those folks who then have to, who have been isolated, and I'll be honest, so my mother is in a nursing home, and they didn't allow visitors in. They haven't allowed visitors in for this whole time. So, I don't live in California, so I actually kind of get to see her more these days because of Zoom. But I think that it's been very difficult for the nursing homes to really to manage it, right? Because not only are they managing the families and the residents, but they also have to manage the workers, because those folks are also getting sick. And so all the ideas for creativity are both to help the residents, but also to help the caregivers, because I think it's really important to do that. And so one of the things I wanted to talk about was a project that we have going on. And we've been using music for several years now to personalize playlists for people in nursing homes, primarily people living with dementia, because there's been a lot of research showing that music that you loved in your 20s it gets stored in your brain in a way that you can access it even when you lose various levels of cognitive functioning. And so it seems to be like the music from your 20s is what is most meaningful, perhaps, right? It brings back happy memories. If you haven't seen Alive Inside yet, it's a documentary film. It was on Netflix. I imagine it still is. But it's a very moving, heartwarming story about how music has helped people living in nursing homes really come alive. So we have that as an ongoing project. And we're adding to our, last year we became a pilot site for TimeSlips, which is a creative arts expression, storytelling activity. And we're going to continue working on TimeSlips this year, even though we won't be able to physically go into places. And some of the things that we found as a result of creative engagement is that it has positive effects for both an observer or an initiator, right? So it could enhance mood, improve sleep, decrease depression and anxiety, reduce the length of hospital stays, and decrease need for pain medication. And some of the things that we're trying to do are group-based creative arts activities to provide a supportive environment for those living with dementia. So really opening up multiple avenues for communication and relationship building, providing a supportive and failure-free environment, and enabling individuals to create something that is of value to themselves and to others. So this is just a snapshot of the TimeSlips program, which, so TimeSlips was created about, I think it was 20 years ago, by Anne Basting, and she was a MacArthur Genius Fellow when she awarded 4 TimeSlips. And she created this storytelling activity, right, where people don't have to remember anymore. So this is specifically for people living with dementia, but really to help bring creativity into their lives. And what it does is, because it frees you from having to remember things. It's one of the worst things you want to do if you have anyone in your life who has dementia or is living with dementia, is to ask them, do you remember when? Because it frustrates them if they can't remember it. And you know, if you base everything of your interaction on remembering, then you're tapping into the one thing that they can't do. So what this program does really allows for their creativity and their imagination to flourish. So this is just sort of one example of what do you call it, a picture. So we show people a picture, and then together we create a story. And there have been a few research studies that show that what benefits of TimeSlips are in terms of both changing attitudes and building connections, and allowing people to engage without being burdened by the need to remember. And for our participants, we've seen an improvement of mood, improvement of quality of life, and some improvement in communication as well. But maybe more importantly, for the people who facilitate the stories, their attitude towards aging and dementia improves because they're allowed to engage with people in a different way, where they really are connecting on a different level versus trying to come up with questions to ask, which is not the best way to engage at this point. For people who work with this population, their job satisfaction improves, and the family and volunteer engagement also improves. And one project that they're doing is called postcards. So they have postcards. They actually have a list on their website of places, of facilities that are accepting postcards. So what we're going to try to do, our team got a little bit of money to run a virtual TimeSlips program this year. And we're going to try to do it in different ways. So we're still brainstorming, but one of the ideas is to do a postcard project. So basically, you kind of write a nice little postcard to someone to brighten up their day. This one says, "This looks like a place where there were plenty of adventures." And sometimes you could even, at the end, it says, "What do you think happened here?" That's a good example of sort of an open-ended, beautiful question. Other ideas, like right now, let's do it right now. In fact, we're going to have an interactive activity, even though I can't see you. So right now, I want you to get your phones out and text to someone. It doesn't matter who, don't say anything about what you're doing, just ask them, what music makes you happy? And then maybe we'll get some responses in the Q&A section. So that's an example of a beautiful question because it allows you to think, right? It allows you to connect to what kind of music makes you happy. And so the whole program is sort of based on that idea of creating opportunities for people to connect with happy emotions, with that feeling of imagination, really. Yes, and so we'll stay on the imagination for just a bit. And one of the things I was actually speaking at Creative Care Institute last week or the week before, and another presenter had talked about pairing up with Meals on Wheels. And Meals on Wheels, for those of you who don't know, is a meal delivery program for older adults who are homebound. And, you know, rather during this time, there have been a lot of adjustments that have had to be made for service providers, right? They have to, they also have to physically distance. And so what they've been doing is perhaps in the past, they were able, like volunteers were able to have a little conversation with someone when they were delivering the meal. But now there's all these protocols and you have to like just leave the meal and run, essentially, right? You can't engage. And so one idea we're trying to work on is maybe putting a beautiful postcard in with the meals, right? So at least when folks get it, that they have something, they're receiving something, hopefully from a student. Because the other thing I would love to do is just have some intergenerational engagement. And so going back to the Next Gen program, the idea of what we have is a campus, creative campus. And our college students are connecting with folks who are older adults who are in programs. And so we have a partner, an aging services partner. And that's where we were doing TimeSlips last year that all stopped in March. And we experimented a little bit with a virtual TimeSlips where we did a Zoom call and we figured out how to share the screen in a way that could replicate looking at the picture, coming up with the story. It's usually a group activity, but you can also do it individually. But the other thing that we're really hoping to implement is something called Tell a Story. So for folks who don't have access to technology, who don't have anyone to help them set up a Zoom call or whatever that might be, we would just call them on the telephone, that old-fashioned thing called the telephone, and just have do a tell a story session with them. So these are the things that we're floating around right now. We're trying to get it ready for the fall. And if you have any interest in participating, perhaps as a volunteer, if you're a social work student, you might have that opportunity to do it for service learning. And then really I guess those are the two options, a volunteer or service learning. But we would love to create a really robust program. And my ideal would be to also include like middle school and high school students, right? So that we could have various levels of generations and include the caregivers and then the older adults. I mean, it could be 4 generations or 5 generations long. But I think that's one way to think about how to connect with people. And there's a whole organization that is devoted to ending social isolation and loneliness. And they put out this infographic about how to prevent loneliness during intentional isolation, which is essentially what we're in, right? And the ideas of connecting virtually, maintaining a well-balanced lifestyle, helping a neighbor, and staying positive. I think that like one of the things that we all should be doing is paying attention to our neighbors, making sure that if people are not coming in and out, maybe they're alone in there. Maybe they need some help. I think that it's a time, even though we're all probably very tired of being socially isolated, it is a time to reach out and create new connections in different ways. Because as we see this rise, I don't know if it's the end of the first wave or the second wave or whatever it is we're experiencing, I think that we all have to think of new ways to engage and stay connected. For all, I imagine that at different times people have different levels of ability to manage it, right? So we always want to think about how to make sure that we're all doing the best we can and connecting in different ways as creatively as we can. And with that, I think I will stop.